Welcome to GME Admin Insights, the podcast dedicated to the GME community. I'm your host, Natasha Brox, and I'm thrilled to be back with you today. I talk a lot about program coordinators, the need to know their craft in every part of GME. They need to continue their professional development and grow. And part of that growth is helping the residents and the faculties when needed. One place we can do this is with their documentation. Have you ever thought about how coding, billing, and their compliance might affect funding? Well, today we have someone that will help us learn how we can do this and help our faculty. I visited the Rybar Group booth when I was at ACGME, and I knew that this would be a great topic for the GME community. So today I have Judy Hardy with me to help us understand this side so we can be informed. Julie is the Director of Revenue Cycle at the Rybar Group and oversees project involving coding, billing, compliance, and reimbursement. She has helped to improve provider financial performance, resulting in additional reimbursement and increased physician compensations while maintaining compliant practices. She has a special interest in process improvement, project management, and operational optimization, regularly providing guidance as to best practices and methods that support processes leading to optimal revenue. Julie has her master's degree in health administration and is a certified revenue cycle executive, in addition to multiple coding credentialings. So welcome to GME Admin Insights, Julie. I am so glad to have you here.
Natasha, thank you so much. I'm happy to be here. I really appreciate the opportunity to amplify the voice of physician reimbursement and compliance in a productive and meaningful way.
Yes, thank you. And I'm so grateful that you agreed to be here so you can help us help the GME community. The Rybar Group, when I was at ACGME, when I saw that, I knew that I wanted to know more of the physician side of things. Just to see the big picture, because knowing how to help our physicians and where to direct them when they need it, that's what, us as administrators do. And I know that's not what our part is, but just knowing and to be there to help them understand, I think for us is something that, we should know a little bit about, right? So, let's get into it. Let's get into all the questions and the fun stuff. So first, just tell me like your journey. Tell me your journey of, how you started from where you are now to being the director at Rybar.
Yeah, absolutely. So I'm actually a third generation coder.
Oh,
Both my mom and her mom, so my grandmother, were coders. And I was pre-law my first year of college. But at some point, I made what I thought was a temporary switch to health information management. And here I am today. So
wow.
I did I did my undergrad at Ferris State in Michigan. And I always say that I was so lucky to start my career at the time that I did.
Mhm.
I joined a large academic medical center right out of college, working in coding for employed physicians. So at the time, they were paid a salary, but were in the process of moving to a quality and productivity based model. So I was lucky to see both sides and to be part of that transition. So from there, I went to an integrated care delivery system in Seattle, where I oversaw both the professional and a very small component of facility coding. And I spent a little bit of time at a health system in Baltimore before I made my way back to Michigan. So I have spent my entire career in physician documentation, coding, compliance, reimbursement, and all things involved with that. I joined Rybar in 2017 and I haven't looked back. I really love that I'm able to have a positive impact on a variety of providers in my role in consulting. So here at Rybar, I oversee our revenue cycle consultancy, which is everything from appointing to zero balance, A to Z.
Wow.
I have a dynamic team that helps providers and hospitals make more money through coding reviews, education, charge master assessments, low paid claims reviews, audit appeals, anything related to making money. That's what we do.
I love that. Making money.
Yes, yes.
I love to make money. Okay. I see it's been your passion, 3 generations strong, but you were
Mhm.
pre-law. Wow.
Yep. Yeah.
That's a big jump.
It is. And, I still haven't ruled out going back to law school
Oh,
someday or even
really?
medical school. Who knows?
Oh, wow. Oh,
Yeah,
wow. Okay. So, I always say just because you or think you're in one field, you can always end up doing something else, as we see
exactly.
right here. You just never know. In 3 generations, that's a long time coming.
Yeah, absolutely.
So, in regards to the residents, how can residents and faculty ensure like accurate documentation and coding practices to like maximize reimbursement within GME?
So, what I feel and how I approach it as my biggest focus for both teaching physicians and residents, it really lies in educating residents as early as possible to prevent bad habits. Coding guidelines change every year. Actually, coding guidelines change every quarter, but the major changes are every year. And, we've had huge changes in the last 3 to 4 years. They were the most significant changes since the 90s. So, there's always a lot going on. And what we really want to do is educate medical students so they have an understanding of how their documentation impacts reimbursement and compliance. Most teaching physicians rely on their resident documentation for their coding, and it's, one of the benefits of working with residents. The resident sees the patient, they document, and the teaching physician attests to the resident's note. So if the resident misses a key portion of the assessment and plan, the teaching physician loses out on reimbursement because of what the resident did or did not do. So that's our biggest thing, is making sure that you're focusing on education. And I'll talk a lot in your podcast today about how to approach the education, how to make it as effective as you can. I have almost 20 years of experience educating residents. Like, I remember the day that I was educating residents and I realized they were the same age as me, so I started when I was younger.
Right.
I started doing this when I was younger than residents. So I've been doing it a long time.
Yeah. And now they're younger than you.
Oh my gosh, it's so crazy, but it's great. It's so fun.
True, true. Wow. Yeah, I think about that sometimes too. Like, oh my, these residents, you're my
Yeah,
daughter's age. You're my son.
right. Yes, yes.
Oh, it's like, oh, God, I cannot believe it.
How are
But
we this old? It doesn't make sense.
I'll be 21 forever. So
Yep,
that's
yes.
what I say. So what do you find? So what are some common like coding or billing errors that may lead to a reduced funding for the GME? And how can we avoid this?
Yes, absolutely. So our role in the world of GME is really unique. And I credit you, Natasha, for thinking outside the box and having me join you today,
Mhm.
because coding doesn't always play a direct role in GME funding, but there are a lot of areas that overlap. So, for example, when a teaching physician sees a patient and utilizes the resident documentation for their billing, like I mentioned, there's a modifier that goes on the claim to identify that the service was rendered with a resident. So this is important for reporting for a lot of reasons, but not necessarily for reimbursement. But a lot of errors that will have an impact, or a lot of errors will have an impact on your cost report in coding, which impacts GME funding. And that's related to how you're charging for services. So we always talk to our clients and we want to see hard coding as much as possible, remove humans as much as you can for a lot of reasons. Especially with services such as pharmacy and radiology, they're order based, medications dispensed, a service is provided, you can bill it. But these processes can lead to both over and undercharging, and that can impact your cost report. So it's important to take the time annually to check what rules are built into your system, see what needs to be added and changed. As with any process, continual improvement is the only way to ensure consistent long-term success. So those are some of the areas that I would focus on first.
Okay. Okay. I can see that. I can see that. We need our money. We
Yep.
do need our money. So I can
Yeah.
see putting those practices into place. So, what are some examples of like specific strategies or initiatives that residents and faculty can implement to improve their documentation accurately and optimize like revenue, um,
Mhm.
within the programs?
Yep, absolutely. So I get to talk about education again because that is one of my favorite things to talk about. But starting education as early as possible is the key. So
Mhm.
our ideal state is to wait a month or so after the new residents start, grab a few of their notes, and then provide education based on what they're currently doing. That way, we're not just spouting off a bunch of coding guidelines that don't even make sense to them. Like
Right.
they can apply what we're telling them to their specific workflow, their style of documentation, And they're not so far into their residency that they already have bad habits, so we always joke, they know where the bathrooms are, now they need to know how to document. So that's like our ideal perfect spot for us to start with them. But we're very realistic about this. Doctors did not go to medical school to learn how to document and code, right? They want to provide the best care for their patients and get paid appropriately for the services that they provide. Full stop.
Right.
So this is why we focus on leveraging tools within their EMR, like templates, macros, smart phrases, whatever there is to help them so that they can put in a minimum amount of effort for maximum compliant reimbursement. So
Hmm.
our philosophy and approach is always to audit to minimum necessary. What's the absolute minimum necessary that they need to get by a payer audit, a government audit, get by in court, any of those situations. But we're going to educate them to best practices so that hopefully they end up somewhere in the middle with their documentation and coding.
Right.
You know, this stuff isn't fun or exciting for most doctors. There's a few, and that's great, but you got to keep it short. You have to help them see the benefit to them and always make sure that they know that you're on their side and trying to help them out.
Right.
So
Right.
it all goes back to education for me. Like, how can we get in front of them and get the right information to them at the right time?
You know what? Sometimes I do wish, and this is just me. Sometimes I do wish, though, like if there was a class,
Mhm.
in medical school, and then like even with
Yep.
like a whole rotation on coding,
Yes.
because it does affect,
Yep.
it does affect. So, and I know that, there are templates, built in, as
Mhm.
backup and everything, but still, I sometimes just wish that they did have a rotation or two for
Yep.
documentation. So that way they at least know,
Exactly.
they at least know instead of like
Yep.
the force feeding that we do in a short amount of time, you know?
Yes, you're absolutely right. And we try so hard at Rybar to get in front of them as medical students as early as we can, even if we can just have an hour in one class. Just let us, we can at least talk about how reimbursement works. And also, talking about templates, they're the good, the bad, and the ugly of compliance, right? Like they are so helpful. They do so many useful things until they're not updated for each patient.
Right.
And we're
Right.
going through a wrap audit right now with a client that didn't update their templates, and it's a struggle. Like we know these patients or these providers gave great care to their patients, but their documentation doesn't show it.
Right. Right. Yeah, that I guess that is a downside about templates
Yep.
that I could think of. And especially if you don't have someone in that role to look and to make sure that things stay updated, I can see
Yes.
where that it can be a hindrance. Yeah.
Yeah, absolutely.
Yeah. So, but that is good to know, though. That is good to know. So, how can like residents and faculties collaborate with the Rybar Group, especially with like coding audits, education, educating their team, just to implement, like the charge validation process, of
Mhm.
things. Make sure everything is accurate with reimbursements.
Yeah, absolutely. Thank you so much for this question. Charge validation is the key to successful revenue integrity. Charge validation needs to look for two things. Is there a charge entered for every single note documented? And did the payer pay appropriately based on their contract? Those two things often don't happen. We assume that they happen with the amazing systems that we have in place now, but sometimes, systems don't work like they're
Right.
supposed to. So at Rybar, we offer solutions based on wherever the client is in their charge validation journey. And that's one of the benefits of working for us is that everything is tailored to exactly what they need. So if an organization is further along in their charge validation journey and they've had a process in place that they've worked on over the years to validate it, we'll check to make sure that their process is bulletproof. Then we'll actually refer them to a software vendor that we work with that can optimize their payment validation. But for those who are newer in this process, we'll work to establish whatever looks best for them, for that organization specifically, that reduces the lift on their already overworked staff. Like we're very realistic. We've all worked in healthcare systems before, so we know exactly how busy everyone is. So we strive and really focus on making sure that we're eliminating all of the work we can. I say this all the time, be tough on the process, not the people, leverage everything you
Yes.
can to help them out. So all of our process recommendations are going to take into consideration best practices, but also the size of the organization and what their initial goals are, knowing that there's time to perfect the process over time. So we just need to start somewhere and move forward with them. We also, all of our solutions are customized. So we do a lot of provider education, whether it's for medical students, residents, or your faculty who have been there for 40 years. Like we can handle all of it. We really just focus on making sure that like the providers know we're always on their side. We don't work for insurance companies. Everyone at Rybar has a shared passion in getting as much money from the insurance companies as we can for those who are providing care.
Right. That's good. That's good because sometimes, if they've been there for like a long time, they may be stuck
Mhm.
in certain ways
Yep.
of documenting. So, what's the best practices that we can offer like now for what's
Mhm.
going on now. So that's
Exactly.
good.
Yep.
That's great. That's great information. Because
Yeah.
like you said, everything is changing. So you have to keep up and you have to change along with it in
Mhm.
order to get the most, and
Yep.
especially now with GME and CMS and all of the new regulations and rules, and we can do this now. We can, start,
Right.
it's
Mhm.
it's everything. And when that happens fast, it's like, okay, well, you know that part, I know this part, they know this part. And so when you come together, it makes it better because if everybody knows their part, how can we optimize and get the most for our money?
Exactly.
Most
Yep.
money out of it. Yeah, that's great. I like that. That
Yeah.
makes so much sense. Well, especially when you think about it, it makes so much sense. And to have, which I didn't know until you said something, and to have like a company, like another resource that you can reach out to help the
Yep.
faculties uh,
Yeah.
with their documentation. That's good to know.
Yeah. And
That's
absolutely, like it can be, especially for administrative staff, a really challenging thing to hear when consultants are coming in. They're going to take our jobs, that kind of thing. Like we do not want to take anyone's job. We want to hold your hand and get you to the place where you're successful on your own forever. And you just come back to us when you need to refine something.
right.
All we want is to make our clients successful on their own.
Right, right. And sometimes we need that backing. Sometimes it's not
Mhm.
always a bad thing.
For sure.
Sometimes it's like, okay, we have too much on our plate anyway. Teach me,
Yep.
what do I need to do? What do they need to do? Okay, and then let's when we come back around, are we still doing this right? Okay, I need a little bit more help doing this, or
Yep.
streamlining this. So it's not always a bad thing. It's something that
Exactly.
especially everybody's busy right now. So
Hmm.
having that
Yep.
specialty come in and teach and learn is something great. It's not like, we have to like try to learn it ourselves. We go to the
Right.
professionals, you know what you're doing, and
Mhm.
you know, and everything can continue to run smoothly.
Exactly. Yes.
Less work, I
Mhm.
like to say work smarter and not harder. And
Ex
then like
100%.
the smartest thing to do.
Yes.
That's not my field, so bring me somebody in that field and to help out.
Yeah.
Yeah,
And even when you know it really well, just every once in a while having someone with the perspective, like we're a national firm that like we all have the perspective of so many different clients who are like you but different. And we can offer like what they're doing different, how they've implemented a challenging guideline, anything like that. It just helps to like smooth everything out for you.
exactly. Why invent the wheel?
Yep.
It's why invent it? So
Yeah.
yeah, that's great. I like that. I like that concept. So are there like any compliance considerations or regulatory requirements that like residents and faculty should be mindful of when doing the revenue?
Of course. So keeping in mind, I'm a coder through and through. This is super technical, but a frequent vulnerability that we see is actually poor documentation by the attendings or the teaching physicians. So in order for the attending to be able to bill for the service that was documented by the resident, they have to document an attestation that states that they performed the service or that they were present for the key or critical portions and that they agree essentially with what the resident documented. So that's one thing where we see either it's not present or it's lacking. Like they'll say something like seen and agree, or it's
Right,
not quite
right.
enough because
Mhm.
Medicare needs to know that like the providers are actually providing education to the residents through direct patient care. And that's how they're going to see it is through that documentation.
Right.
But
Right.
another risk area that we frequently see, like a big time saver and somewhere that like Medicare really gave a lot in the most recent E&M or evaluation and management guideline changes, is allowing to bill for time. And those guidelines have relaxed a lot. Um, well, another something that teaching physicians have to keep in mind is that it's only their time that they can use for the code selection. Medicare pays for GME training separately under Part A. So the resident's time is really already being paid for
Yeah.
that way. So that's why it has to only be the attending or teaching physician's time that's used. There's also like the primary care exception that has, it's a little bit lower on the realm of like what's a high risk area, but it's there a little bit for Medicare. And that's essentially when residents are moonlighting as essentially functioning as an attending. But you know, like when your teaching physicians are employed, the hospital, health system, or organization that they work for is the one being paid by the insurance company for the professional service, and then the system or organization is paying the doctor. So that's what puts the entire organization at risk with documentation and coding. So while it's not really a direct impact on the GME funding, it's a pretty obnoxious trickle down effect when it
Right.
happens.
Right. Right. Yeah. And I always say that, like, we can sometimes the documentations can make or break, the money aspect of it.
Yeah.
And like you said, even though we're not directly impacted, we're still
Mhm.
impacted. Yeah.
Absolutely.
hmm
Yep.
I tell you, that's why documentation is key. I always say that documentation is key.
I love hearing that.
Oh yeah. Oh yeah. I say that, and that's for like every realm
hmm
of working,
Yep. Yeah.
NG or not, like
Yeah.
everyone,
Right.
documentation,
For sure.
gotta
Yeah.
have documentation.
You know, the other thing is for residents, like maybe they'll stay with the health system and remain employed, or maybe they'll go start their own practice or join another private practice where their documentation really, like if they're paid based on RVUs, like their documentation has to be on it for them to get exactly what they deserve.
Oh yeah,
So,
especially with the
it,
RVUs. Yes,
yep, yes,
yes, because everything counts, and they
yes,
want their money,
yep,
so documentation is key.
exactly, yep. And that's like your documentation essentially determines your RVUs.
Yes, which determines your paycheck.
Exactly, you got
Like,
it.
how much money do you want this month?
Yeah, right.
Do you want
Yeah,
pennies or do you want, the folding kind? So
yes, yes.
that's how they can learn the hard way too, though.
Mhm, for sure.
Yeah. 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 So if they're not documenting, they don't
Yep,
get paid and they've done all of this work. And it's like, well,
exactly.
you didn't document, so
100%.
where's your money?
Yep.
That's so funny. That if when you look at it in that aspect, it totally makes so much sense.
Yeah.
And you shouldn't lack just because it doesn't, like for Jimmy, it doesn't go towards their, personal RVU. So they
Right.
still shouldn't lack on it because you never know when
Mhm.
they go somewhere and it
Yeah.
depends on it.
Exactly. Yep.
Mhm. So, and then that's just good documentation for like even the patient aspect of things when they want to know what was done to them and
Yep.
and especially if they have to take that documentation to their specialist or something like
Yep.
that. That's good
For sure.
patient care too. Yeah.
Absolutely. And when we're educating physicians, like, it's definitely like at the beginning trying to figure out, okay, what's going to motivate this physician? Is it the dollars? Is that how I'm going to motivate them? Talking about how to optimize their RVUs. Some of them need the scare tactic, like just because you got paid for it doesn't mean that it was done right. And if the government comes back, not only are they going to ask for that money back, but they can ask for tens of thousands of dollars per
True.
claim.
That's
Like
true.
it's astronomic. Plus, like all of the money you have to pay lawyers and consultants like us to help you out with
Mhm.
it. So
I didn't
it's
think about
just,
that. Yeah.
yeah,
The scare tactic may work every time though.
it can.
That is true. I didn't think about it like that. That is true because, $1,000 may be $15,000 or,
Yep,
1,500,000, you just never know.
exactly.
You
Yep,
get documentation right and you can get fined and, oh,
right.
yeah,
Yeah, that's why, like, when we see a provider who's making like a $6 error on every other patient that they see, it's like that's not actually a $6 error
yeah,
that can turn into a big, big, big deal.
that's
So,
true. It adds up
like,
over time. And then when you get the government involved in it,
yep,
right. And then they would check
exactly.
every account that you've done,
Yep,
everything, all the documentations
yep.
that you've done since you started until now, and that could add
Mhm.
up big time.
Oh, absolutely. Their extrapolation methodology, I could do a whole other podcast on that. It's not fair. So again,
It's
that's why like
why
we're
it's
always
important.
focusing. Yes, that's why we're always focusing on education. Like, let's just do it right the first time as much as we can.
Yeah.
We're
Which is
realistic
understandable.
about it.
Yeah. Do it right the first time. You don't have to touch it again. You don't have to go back.
Yep.
You can just keep moving. That's so true.
Yes,
And
exactly.
so like for my final question, um, so can you share like any insights or best practices for effective like appealing a denial or
Mhm.
addressing the audit findings that will protect them and their reimbursements?
Yep. Yeah, absolutely. So I'm going to start by talking about a compliance plan, which I know that I'm going to lose some people right now when I talk about this, but just hang with me for a second because like compliance plans are the absolute worst, but they are the foundation for an organization, right? And if your compliance plan isn't working, then you have to fix it to make it work for you. Don't just use the OIG's guidance if it doesn't work for you. Tailor it to meet your needs. Like we were just talking about, like billing correctly the first time is always going to be the goal. You're going to get optimal reimbursement and you'll be audit proof. But you're always going to, like, when you're focusing on not making errors in the first place, like that's a really important thing. But the reality of the situation is that I always tell my clients is that they are non-compliant 100% of the time. I was the revenue cycle director at a large health system here in Michigan before I came to Rybar, and I had a weekly meeting with Blue Cross to go over everything that was going wrong. We didn't even wait for there to be a problem. We just had a standing meeting so that we would cover everything that was going wrong every single week.
Oh, that's great.
There's always going to be something wrong, so focus on what you can control. So, like I said, focus on prevention and leverage your technology. Like I've talked about, be tough on the process, not the people. Hard code what you can and train humans to do everything else and retrain and support them as much as you can.
Mhm.
And then you can get into like more of the details, like assess who has responsibility for denials. How much of it stays with billing or PFS versus how much it goes back to the coders? How can you keep that streamlined? Because denials are expensive. I think that like the cost just to submit a claim is somewhere around $15, and then to work a denial is somewhere around $96 per claim, which is pretty expensive. So if you're able to keep some of those denials within your billing department instead of your coding department, you're probably going to be able to do a little bit more root cause analysis and fix some things before they go out the door. Unfortunately, billing and coding are not the same thing. They don't follow the same rules, so they need to be kept separate, but they need to talk when it comes to denials. Now, you mentioned audit responses and denials. Like making sure that you have your procedure in place is really important. And that procedure needs to include like what records are you going to send the clients
Mm.
or to the payers or the government or whoever requests it.
Right.
But like one of the things that seems like common sense, but it's really not, respond timely and comprehensively. It's very easy to ignore a request for additional documentation from a payer, but that's exactly what's going to lead to an audit if you don't respond to it. I can't tell you how many clients come to us for assistance with appeals after the deadline to submit records or an appeal has already passed.
Uh,
So, I would also recommend, so like once you get that part of it down, like you should always have a second set of eyes on what's being sent because you don't want to overshare or undershare. There's strategy to what you're sending. If you're having your medical records department always send the same set of records, you might want to have someone take a look at them because I'm not saying that you should hide stuff, but for that first request, maybe you shouldn't send bad anesthesia documentation. Like it happens. Just don't send it and see how it goes. Like if you know it's not a systemic problem, be a little bit strategic with it because you're opening yourself up to a lot of vulnerabilities. And like I said, you're already non-compliant 100% of the time. So just like do the best that you can with your initial response. And of course, I'm always going to say, I'm a consultant, so I'm going to say this, engage external assistance, usually through an attorney though. And the reason that I recommend an attorney is because they have standard communication they use that's proven to be successful for them. And they also probably have connections with the payers who are going to help them out with the process. So that's why like those initial documentation requests, like definitely keep those in-house, be a little bit strategic about them. But once you start getting into the appeals process, it can really help to bring someone else in, especially when they're looking at something very specific, one specific procedure, one specific provider, something like that. That's when it becomes really helpful to have some more specific expertise on your side.
okay, so don't really show your full hand.
Yes, yes. And again, we're not saying to hide, don't hide anything, don't never amend your medical records, all of the above, but be
Yeah, because
strategic.
you don't, I mean, like, why open the door to something bigger if it doesn't have to be?
Exactly. Exactly.
So
Yep.
if you're asking for this, there's that,
Yep.
and that's
Yeah.
it.
And your auditors are human too. So you never know what they're going to find or what they're going to miss.
Right.
It can work out to your
Exactly.
advantage and disadvantage.
Yeah. I completely understand what you're saying. Yeah. Yeah. Okay. Okay. Yeah. Because it's like, okay, so you're denying this, but here's this, here's
Yep.
that. Not here's the proof, and then this, and then yeah. You can make a mountain out of a molehill, and you don't want to do that sometimes. Less is more.
Exactly. Yep.
Less is more.
100%.
Yeah. Totally understand. I get that. I get that so much. This has been like really great information um to take in, to learn, especially for those who don't know. Um just especially like for the GME community, just to know. So if you don't know, then you know who to reach out to,
Yep.
know where to go. Where can I find this resource? How can I
Mhm.
understand this?
Yep.
Because a lot of times, they come to us and like, well, what about this? And what about this? Well, I don't know.
Yeah.
So it is great to have, somebody in our back pocket,
Mhm.
that we can reach out to for these questions and be like, you know what, Julie, I don't know. So can you talk to this faculty for me,
Yep.
and then take it off our plate, which is
Absolutely. You can't know everything. Lean on
exactly.
lean on
And I
someone
don't
else
want
when you
to.
have to. Yeah. Yeah. 100%.
I know my field and I know my lane, and I keep the stuff to the pros, like in those lanes right
Mhm.
there. So, but it is good to know like who can I call in case this ever happens, if they have a situation, or even if like we do didactics. So maybe
Yep. Mhm.
they want to do a didactic on it, and how can we help it?
Yep.
In onboarding, like we have onboarding of residents. Who can we come?
Exactly.
They could talk to them about it, or you know
Yep.
or even with onboarding new positions. um, Here's who like bringing you in. Here's
Mhm. Yep.
we're going to show you how to document. They're going to you know you know show you the ropes and what to do and not to do, and all of that.
Exactly.
Yes.
Yep. And it takes the lift off your internal team
Yes.
that's already, like July 1st, they're already tied up. Like they don't also want to be focusing on this. It takes that burden and that lift away from them and lets us, it's what we
Yes.
do day in and day out.
That's great. That's great. So if people want to reach out to you, get to know you, ask you additional questions or anything, what is the best way they can get in contact with you?
Definitely feel free to connect with me on LinkedIn or visit the rybargroup.com, and all of my contact information is on there.
You heard her. Look for Julie Hardy on LinkedIn with the Rybar Group. Thank you so much, Julie, for joining me today on GME Admin Insight. It was great speaking with you and giving, the listeners some great information that they can take back with them.
Absolutely, Natasha. Thank you so much. It was a pleasure.
Thank you. So we have been speaking with Julie Hardy with the Rybar Group, giving the GME community some great gems for the residents and faculty. So please reach out to her on LinkedIn if you have any specific questions for you, your program, or your faculty, and they can help you with anything that you need. And with that, we conclude another enlightening episode. And remember that your dedication keeps the gears of GME turning, and your growth matters. So until next time, community, we are signing out. I think I found her. She's